Good evening, everyone, and welcome again. I'm going to give a couple seconds for some folks to come into the webinar room, and we'll get started. All right, now I think I'm going to go ahead and get started. Good evening again, and my name is Judy Gardner. I am the Executive Director for NAMI, Washtenaw County. This evening, we're pleased to be presenting the third and final in this webinar series on navigating a mental health crisis. Tonight, we will be discussing what happens after a mental health crisis. And this series is brought to you by NAMI Washtenaw County, Michigan Medicine, and Community Mental Health. Our panelists this evening are as follows. Cristobal Acosta. He's a certified peer support specialist, and he's also a Washtenaw County NAMI volunteer. From Michigan Medicine, we have Dr. Tyler Grove. He's clinical assistant professor. And from Community Mental Health, we have Katie Honer, who's a program administrator for the adult MI team. And Katie will be addressing long-term and recovery-focused care. I'm going to have to go back a little bit. And our Dr. Tyler Grove will be talking about once the patient has come home, now what, and follow-up care, and what recovery looks like after a mental health crisis. And then Cristobal Acosta will talk about living with a mental health disorder and after a crisis. So this evening, we'd also like to remind you all to submit your questions in the Q&A. We're going to have a Q&A session at the end of after we hear all of our speakers. So to start this presentation this evening, I want to introduce Cristobal Acosta. Hello, Cristobal, and thank you.
Thank you, Judy. My name is Cristobal Acosta. It is my pleasure to be here. And so I'm talking about after the crisis, correct? Okay. So after the crisis, there's recovery. And there's a few dimensions to recovery. One of them is coping strategies. And I have various coping strategies that have aided in my recovery process. One of them is time and silence and meditation, like a mindfulness type meditation. I'll just sit, I might close my eyes and take deep breaths, slow deep breaths. Another coping strategy is listening to music. I know that music can boost serotonin and dopamine neurotransmitters in the brain. So I really like to listen to music. Another coping strategy is pep talks. I give myself pep talks. And my pep talks consist of different components. I'll ask myself, what am I grateful for today? I'll ask myself, what's troubling me or worrying me, and I'll work it out in the most positive way possible. And these pep talks sometimes turn into prayer time. I might be saying these things out loud, not just to myself, to encourage myself, but also to talk to God, my creator. And then that's basically what I do. I work things out. I might repeat some Bible verses or motivational quotes that I like. Another coping strategy, as I briefly mentioned a minute ago, is my faith in God. I couldn't have made it to where I am today without God's loving guidance and assistance. I believe that there's an emptiness that a lot of us feel inside, a void, even people who don't have a mental illness. And in my personal opinion, my humble opinion, the only thing that can fill that void is a relationship with God. No amount of alcohol or tobacco or the latest handheld device or material thing can do it. Only God can do it. Again, in my humble opinion. So those are coping strategies. Another coping strategy is just health habits, good health hygiene, eating right, sleeping right, exercising. And I do all these things. Those are most of my coping strategies. The other dimensions of recovery would be remembering that it's a process. There's going to be ups and downs in recovery. I've experienced many of them. There were times when I just wanted to give up, but I never did. I kept going. I've had the support of my parents and a couple friends. And my dad always told me, never give up, keep going. And I've taken his advice. I never gave up. So there's a quote that says, the race is not always to the swift, but to those who keep on running. And I like that quote because that speaks perfectly as to my journey so far. I'm not the fastest thinker. I'm not the most sharpest tack in the box, but I do keep going. And that's how I've gotten this far. And also with God's support and the support of my friends and family. Another quote I like is, it's not how you fall that matters, but how you get back up. I've fallen many times. I've made many mistakes, and I will continue to make mistakes like anyone, but I learn from them. Sometimes I have to make mistakes over and over again. It's a learning process, and it's a journey. So I kind of talked about my support system a little bit. I'll kind of expand on that by saying that my support system also includes professionals like a psychiatrist, and family, friends, as I mentioned before, and just the general community. What else could I say about recovery? I was hospitalized 6 times. I have bipolar disorder, and I have been through it all. Basically, I've experienced mania, depression, psychosis, anxiety, paranoia, suicidal thoughts. So I've experienced everything, basically, and I have been episode free for 16 years, at least now, 16 plus years. I was on Social Security for many years and working part-time at CVS Pharmacy and Salvation Army. But now I got off Social Security and I'm working full-time as where I've been now for almost 3 years, close to 3 years. In March, it'll be 3 years now, at the job the career that I love and that I like and I love, CMH, Community Mental Health, Washtenaw County Community Mental Health. So there's a lot of growth opportunity in this career, and this is where I'll be for a while. I'm pursuing my master's degree in social work, and it's definitely a challenge. It's testing my limits, but I'm up for the challenge. I'm not sure what else to say at this point. I guess I'm married to my wonderful wife, Carrie. She has bipolar as well. She was diagnosed with that diagnosis. And we do fun things together. We go on to Cedar Point almost every year for the last 11 years. And we dine out together. We like Cracker Barrel on Wednesdays, get the broccoli cheddar chicken. So it's all good. And I married into a beautiful Christian family. I think I have a couple more minutes left. I would just say, for people who are struggling, to hang in there, don't give up, and do your research on your mental illness, read books, and be your own advocate. Reach out to people, don't isolate. Okay, 3 minutes. And yeah, those are the things that I would say to help in recovery. And oh yes, I was also a volunteer for NAMI, the National Alliance of Mental Illness of Washtenaw County. And for a few years, I was a peer-to-peer facilitator, which I enjoyed. And we would meet at different places. One place was the Fresh Start Clubhouse a few times, and another place was I can't remember exactly, but Avalon Housing, I think. Avalon Housing. Met there during a session. So I was a facilitator, co-facilitated. I took the training, the old training, and I would recommend it to others. I liked about it. I liked just interacting with other people who were also struggling, and I liked just being able to help people and be a part of something bigger than myself. Okay. So I'd like to pass this on to Dr. Grove now. Thank you for your time. Thank you for having me.
Thank you, Cristobal.
You're welcome.
Yeah, thank you, Cristobal, and I'm happy to be here today talking about, to be a part of this series of talks about navigating, a mental health crisis. And I know that previously it's been talked about, what to do prior and then during. So I'm here to help out to talk about what to do after a crisis. I guess we can go well, yeah, I guess for my intro, I can just say a little more. So I'm a clinical assistant professor at the University of Michigan in the Department of Psychiatry. I work in several different clinics within the Department of Psychiatry. And yeah, clinical psychologist. That's what my background, PhD. And I do a lot of therapy. I also help out with a lot of groups that we offer at U of M. So yeah, it's been a passion of mine for a long time to try to help people navigate their mental health and a crisis as well. So again, happy to be here. And I think maybe we can go to the next slide. So yeah, returning home, now what? So if someone's returning home from being hospitalized for a psychiatric reason, what are the next steps? What does it look like? What should we do? Well, a lot of the research shows that it's critical to either return to your provider previously, so outpatient mental health provider, someone in the community who maybe you were seeing, weekly or monthly or every so often before being hospitalized. Now that you've been discharged and are leaving the hospital, we want to reestablish with that person. If the hospital was your first point of contact with psychiatric care, so now we want to engage in ongoing care. So we're gonna established with someone in the community who you can see on a regular basis. And we know that people were vulnerable after coming out of the hospital, and so it's really critical to see that mental health provider who's going to be helping you within a week, ideally within 1 or 3 days, but no more than a week. And that should happen as part of the discharge planning in the hospital, where that appointment is scheduled. And part of that process too is coordinating care between providers. So it's great for that person who's going to be seeing you on a regular basis to have medical records from your previous medical records, just in general, and maybe from the most recent hospitalization. Part of that is going to include your prior safety plan that was developed. It's good to review that with your new provider so that everyone is on the same page about that. So, the safety plan is basically step-by-step guidance with what to do during a crisis, some effective coping strategies. Also, if the person was in school prior to being hospitalized or the crisis, it's good to reach out to the school, see what kind of support they can offer, potentially keep them updated about what's going on. It's just good to have that communication. And other things too include ongoing risk modification and assessment. So making sure that the environment is safe when that person is coming home. So trying to remove lethal means, ideally removing all firearms. If that's not going to happen, then putting them in a gun safe, keeping them locked and not accessible. And the same goes for potentially knives, limiting or removing access, or sharp objects. Maybe kind of restricting access to medications as well to prevent medications being used in a way that could be harmful. Another thing too is there are partial hospitalization programs. So maybe going from the hospital to home feels like it would be a lot. So part of the transition could be engaging in a partial hospitalization program where during the day you're engaged in kind of mental health treatment, therapy, but then you're coming home. So sometimes that can make the transition a little easier. Yeah, so I think we can go to the next slide. Yeah, so supports needed to sustain progress. So before I was talking about establishing ongoing care or returning to ongoing care, what that can look like is medication management. So if medications were started in the hospital, then your provider can now take over and make recommendations, adjustments. Important to keep taking the medications as directed, even if you feel like things have improved a lot. Part of that improvement may be related to the medications, so you want to stay on them to ensure that things continue to progress. Ongoing care can also involve psychotherapy. That can be individual therapy, it can be group therapy. There's different types of therapy. There's kind of more supportive therapy, where maybe focused on problem solving and things that pop up, and processing thoughts and emotions in events. There can be more structured forms of therapy, like cognitive behavioral therapy, that's very skills-based. And the idea is to give you even more coping skills than maybe what you've already had, or a review of coping skills that you've learned and just building on top of that. Also support groups, peer specialists. So someone like Cristobal, who is going to, have great guidance and be a great resource, peer specialists and support groups too. And self-help books, self-help books can be, I think in addition, they can kind of add to medication management, psychotherapy, support groups. They can provide even more information and kind of in addition to what you're already doing, they can be helpful. And I put attend medical appointments because you know, physical health and mental health are absolutely related. So if we're taking care of our physical health, that's going to help our mental health. So staying on top of medical appointments is going to be beneficial. And involve family and natural supports like friends through this recovery process. Family can not only help with like transportation and scheduling, things like that, but they just provide a level of support and encouragement that can be really beneficial. I also wanted to talk just a little bit about expressed emotion. So it's a concept that's been studied quite a bit, and we know it's related to outcomes for people who have had mental health difficulties. And so the idea of expressed emotion is that sometimes there can be hostility or critical comments that it makes sense why they happen. There can be frustration, and sometimes our emotions can get the best of us, and these things come out, and they can be upsetting and can potentially stall the recovery process. So it's good to be mindful of that, be aware of it, and see if we can even kind of prevent it, if possible. There's also part of expressed emotion that can be emotional over-involvement. So we can be really trying to help someone going, you know, through a mental health crisis, and we you know, we may kind of almost like take over with things. So we start doing a lot for them, which I know that sounds like a good thing, and it is, but sometimes it's good for us to exercise our independence, for us to, you know, exercise some control. I'm going to do this. You know, I'm sort of in charge of this, or I can take control of this. So sometimes hanging back and letting that person engage in things and make decisions is important. So yeah, I just wanted to bring up this concept of expressed emotion. It's something for all of us to be aware of and potentially trying to work on to reduce. Yeah, we can go to the next slide. I know I don't have a lot of time, and this next slide I won't spend a lot of time on, but with recovery, when we talk about it as it's defined by the individual. It means something different to everyone. So part of the process is defining what does recovery mean to us. It could mean I want to increase my social connections. I want to pursue hobbies and interests. I want to have a daily routine. I want to avoid substances. I want to learn stress management skills. I really want to return to work or volunteer or go to school. Things like that. So we all define what recovery means for us, and it means something different to everyone. So it's important to start thinking about what does recovery mean to us. And yeah, with that, I will turn it over to Katie.
Thank you. Thank you, Dr. Grove. Good evening. So once again, my name is Katie Honer. I am a program administrator for Washtenaw County Community Mental Health. I oversee our adult services, so our programs for adults with a serious mental illness. And that encompasses quite a bit of programming, which I won't get into because we want to talk about recovery and really bridge what's been talked about already. So really appreciative of Cristobal and Dr. Grove for setting me up so beautifully. So next slide for me. Thank you. So recovery is possible. So we heard from Cristobal that recovery is possible from a mental health crisis. So these things happen. We have all had some sort of crisis in our life, whether it was a mental health crisis, a financial crisis, housing, whatever it may be. Everyone in their life has gone through some kind of crisis, and mental health crises are out there. And again, that severity and impact, as Dr. Grove was describing, is really up to us to define, and our recovery is also ours to define. So recovery is possible. How mental health is defined, mentalhealth.gov defines it. Recovery is defined as how we work to improve health and wellness, living that self-directed life. So those choices are going to be ours to make. Again, with those supports, Cristobal did a really wonderful job of outlining support networks through professionals, natural supports, volunteer organizations like NAMI, peer-to-peer supports. So we've really talked a lot about support networks, and that recovery community is something that I'll probably hit on a few more times. And then, of course, striving to achieve our full potential. So some individuals after a mental health crisis are going to return to their lives as they were before. And some are not, and that's okay. Like, we are working to achieve that full potential as it is in that moment. So there are going to be some things going on that are not available to us at that moment, and that recovery journey may take time and our lives may look different. Next slide, please. Thank you. So SAMHSA, our Substance Abuse and Mental Health Services Administration, which really helps us out in the CMH world and many others to put forth evidence-based practices and a lot of great programming. So we rely on them, a lot of grants for us to explore different programming to support our services, defines these current 8 dimensions of wellness. And we think about these in all recovery planning. And we saw quite a bit of these dimensions on Dr. Grove's slides as well. So this emotional support. So how are we going to engage after a mental health crisis, whether we were hospitalized or we were able to navigate this in the community? Are we going to add a therapist? Are we going to attend groups, those peer groups, see some kind of support group? What is that going to look like? So that emotional wellness is obviously a big piece of what all of us are here for and here to support, and really is the passion of all of us on this particular call. So we really are invested in that emotional well-being. Spiritual well-being is a big piece of a recovery process, and it looks really different for everyone. So we want to make sure that we touch on that, whether that's a meditation practice, a prayer practice, a lot of people, that's walking in nature. So that can look very different for everyone. Intellectual practices, so whether that's learning new skills, engaging, reading, whatever that may be. So that exercising of our minds. Physical, Cristobal talked about his own exercise practice. So moving the body. So a big part of our own recovery and recovery from a mental health crisis is that movement. And that's often a hard thing, as some of those reactions from medications can be very sedating. So we really do look at that dimension and that connection with medical appointments, as Dr. Grove pointed out, as being a really important connection to have. That physical well-being and health ties into all of this. We want to make sure we're addressing that. Environmental health, are we in a safe place? So are we safe in our environment? Are we well? Do we have what we need? That safety element. Financial, of course, that's a stressor if we're not addressing that financial health and well-being. Occupational, are we working? Do we want to be working? Is that structure around that available? Is volunteering a better option? And then of course, social. So we all are social beings. We need that form of connection. And what is that going to look like? So a big part of safety planning, as Dr. Grove was talking about, is identifying not only what are we going to do as the person recovering from a mental health crisis, but who's going to be involved in that process, and assigning those tasks to that support and recovery community, because it really is not on us alone. Cristobal really highlighted that this is not a solo process. So really getting those pieces in place for that recovery and that wellness piece of things. So we really work with all of these dimensions to say that though they're not always even, this picture really shows these as being these nice, even circles that are of even size and shape. And as we know, life doesn't work that way. So we may feel really full in our emotional well-being right now, and maybe not as full and supported financially. And so it's, how do we look to get a nice balance for us? Even balances are very challenging, but a big part of recovery is outlining these dimensions are a great start. We may have others that we want to focus on, and saying, how do we feel we can sketch that out, and who's going to support us in doing that in order to move forward. We can go to the next slide. Thank you. So recovery plans. So we've addressed these a few times from a few of us because they are very important. So as I was just saying, our recovery plan may initially, if we're coming from a hospital setting, may comprise of one or two of those areas. Or we may be in a place where we are feeling really good about having a recovery plan that encompasses all of the dimensions of wellness. And again, we may want to add something, we might want to have subcategories. The time recovery takes is an ongoing process. So there's no end date we need to have in mind. We're not rushing through a process. We're really taking the time. And I believe we've all stated too that there are infinite pathways to recovery. So we want to explore, we want to find the fit that is best for us and try out and find things that are best. And with our recovery plans, we want to identify goals. We want to achieve our own sense of wellness. We want to be specific and also have aspirational goals as well. But in that post-recovery stage, as Dr. Grove said, really identifying our outpatient mental health provider, we want to be specific with that. Our long-term goal may be, our aspirational goal may be something that's a little more vague. And then who can help us to achieve those? So we really want to find those people that can help us so that we are not feeling isolated, as Cristobal said. We don't want to feel that this is something that we have to manage and carry on our own, which is a big part of having professional supports, having natural supports, having support networks. And then, of course, tracking any changes. So if a medication makes us feel a certain way, tracking that so that we can discuss that with a prescriber or provider and how it's affecting our own mental health, and finding ways that we can move our recovery forward. It's not linear. I think that's been mentioned also. It can be up and down, it can be a little squiggly. We accept that, and we know that all journeys take some different tracks. Some are expected and some are not. And we want to keep ourselves in a place where we recognize that there are people out there who have that lived experience. That's why we rely so heavily on our peer supports at Community Mental Health. That lived experience is worth more than all the textbooks. So we ask that our recovery specialists really help to talk to people about how recovery is possible. And I will hand it off to Judy. I think we're going to move to our Q&A now.
Wow, that was really terrific. And it did, I agree with you, Katie, that it did just kind of wonderfully formed together from Cristobal starting and then the doctor and then yourself. So thank you very much. And thank you to our other panelists. And I also want to thank tonight all of you who decided to participate this evening and take time out of your day to lean in and listen to what we had to offer, because this information, there might not be a lot of people on this call, but this information I'm hoping will grow beyond ourselves, and you will share this with so many people who definitely need it, because of course we're still fighting stigma, and really we got to get that message out to help others through some of these very difficult times in a crisis. So this is the start of our Q&A portion of the segment, and I would encourage everyone, there should be tons of questions in the Q&A, and I'm going to look in there now and see what we've got, because these are, I think after can be one of the most challenging times, at least as a person who lives in support of a loved one with a mental health condition. I myself have a couple questions here. So the first one, I will read and then I can figure out who that should go to. So here it is. A common complaint I hear from those needing mental health support is that they don't like their therapist, doctor, or psychiatrist. They don't feel they have options to find a new provider because it took so long to find the one they have, or because their insurance won't cover someone else. What feedback can you share to help inspire others to keep trying to find someone they can relate to? Conversely, what tips can you offer for someone who wants to doctor shop and not face the facts about themselves? So I believe every single one of our panelists tonight can answer that, but I'm going to have to go, I want to go over to Katie Horner and ask you to start, and maybe you, and then maybe the doctor can chime in too.
Absolutely. Those are phenomenal questions. We have, and Michigan is not alone in this, we have a incredible psychiatry shortage. So there is a provider shortage, which makes that question extremely poignant. It is hard to find a prescriber. There are incredible wait lists. So you are absolutely right that finding a psychiatrist and then adding those insurance layers is very challenging. So that said, asking within, if you're in a particular clinic, if they can refer you to someone is a nice option. If there are multiple providers within a particular clinic, if they can do an internal referral or transfer is a nice way to start, because not everyone is meant to work with every single person. So that's where I would start. And then if you do have to transfer clinics, that is challenging. So I don't want to minimize that concern. That is something that we see a lot of. I don't know if Dr. Grove has anything to add to that.
Yeah, no, I completely agree with you. I was going to build off that and say, like, the system is not very great, in all honesty. There are huge wait lists everywhere. It's hard to meet the demand. And then there's the insurance layer on top of it. So even if you do find someone, maybe insurance won't cover it. So there are a lot of hurdles, unnecessary hurdles, and it's extremely frustrating. So I think, yeah, whatever resources you have, utilize them. If you can get referrals for other places, if there's recommendations for other clinics, providers, pursue those, call them. I tell everyone to call those places, get on the wait list, be on multiple wait lists. It's okay, you can always take your name off of it, but get on as many wait lists as possible, so that you have an opportunity to explore other providers. Because yeah, if you're not happy with your provider, there may be something else that feels more comfortable and a better fit. So absolutely explore that, and yeah, there will be difficulties and it's extremely frustrating, but just keep pushing through, and hopefully you can find that fit. And to the other part about someone who isn't facing the facts, and maybe was said doctor shopping, that's also really difficult, because a lot of psychiatric treatment involves motivation from, ourselves, from the person who's going to engage. And if that motivation is low, it's really difficult. What we try to do is we try to kind of build that intrinsic motivation, as we call it. And we kind of say like, yeah, like what benefit would this be at all? Sounds like maybe there's not, this isn't going to be helpful at all. And then maybe someone will say like, well, no, I guess it is a little helpful for this. And there's your thing to kind of grab onto and promote. Like, okay, yeah, maybe we could explore this. Maybe it could help out with this thing that you're saying is a difficulty, not me saying it's a difficulty. So that maybe can build some motivation for someone to engage.
That's terrific. Thank you so much, Dr. Grove and Katie. The next question, this is going to be for you, Dr. Grove. Can you explain exactly what expressed emotions mean? Or can you talk more about what about expressed emotion? For example, can positive emotion feel stressful to someone in recovery?
Yeah, well, so the whole idea with it is that if there's kind of hostility expressed or critical comments, so examples could be, we may be blaming someone for, what's happening. We may directly blame them, or we may say that they're being selfish or they're being lazy, when in actuality that's probably an expression of the psychiatric symptoms. And again, like sometimes that's not even intentional. Everyone's frustrated and those things just come out. And so we kind of want to be aware of that and see if we can, kind of pump the brakes, slow things down. If that critical comment was going to come out or we were going to blame someone, maybe we go a different direction with it. Maybe we don't say much at all. If we were gonna, we knew we were it was just gonna escalate things. So we're trying to de-escalate things, because that could be a source of stress for someone. So especially, they're coming home from the hospital, and then if they go into an environment that's stressful, where they're getting the hostility and critical comments, we know that stress makes us vulnerable to symptoms. So then it could lead to more symptoms and potentially, a worsening of things and maybe another mental health crisis. And the emotional over-involvement part that I was talking about, it's we want to help someone, so maybe we're making decisions for them or really involved with things that maybe they can do and they would find rewarding to do those things. So we don't want to take that away from someone. We want them to, yeah, I did this, or now I'm in charge of this, I'm doing these things, and we can help them, assist them with that, but we want them to have that kind of independence, where they're kind of owning that and making decisions. And that can decrease frustration, because maybe that person's frustrated by, like, I feel like I'm not in control here, like everything's just done for me. So that can help ease frustration. So yeah, this concept of expressed emotion, it's been around for a long time and it's been pretty well studied. And the biggest thing to take away is that it can kind of undermine recovery. So we want to be aware of that and thinking about the environment and the level of stress that could be happening in that environment, and what are ways that we can be aware of it and potentially reduce it.
Thank you for that. I know it's very difficult for caregivers to understand this concept as well. Sometimes when your loved one is released from the hospital or they're on medication, and you're like, why is it taking so long to work? And why isn't recovery faster? So can I have you speak a little bit about Dr. Grove and Katie? I'd like to get your input from that too. And then I'm going to go to Cristobal afterwards. How long does recovery last? Can you talk about recovery? I mean, is it a year? Is it 2? Is it 6 months? What's recovery?
Yeah, I'll go back to what Cristobal said, where it's a process. I'm pretty much saying that every day with everyone I work with, that this is a process. It's hard to put a timeline on it, and it can add to the frustration if we're thinking of like, okay, compared to last week, is it better? Even compared to a month ago, is it better? I tell people to think, maybe we want to expand that. So like 6 months ago, where were we? Do we feel like we're handling things better than we were 6 months ago or even a year ago? Because it is absolutely a process and it's ongoing. It takes time. And we're going to define that recovery. So, you know, one of the examples I talked about was like someone wanting more social connections. That's what recovery means to them. So that'll be a process of expanding the social network and building those relationships, and that won't happen overnight or probably even within a month. It'll take a while. So we have to be flexible and patient with the process.
Yeah, I really appreciate that answer and agree. And we talk a lot about in the field of psychosis that the brain recovery from that kind of event is long. So a psychotic break, if that's the event, and that can be the psychiatric crisis, can take 12 to 18 months solely for the brain to recover from that process. So we are not talking about, you know, breaking our finger and we can kind of see that recovery and feel it and observe it. And we're like, okay, yep, I can do, you know, my exercises. This is a healing process and it takes so much time and we can't watch it happen. And we have to allow, and have to is strong language, and I understand that, but that healing and recovery process to happen. So there is a lot of, from all of us, not only from caregivers, though there's that tremendous investment, and we love when we have caregivers involved and loved ones, because that's not always something that we have for individuals that are going through that kind of psychiatric crisis. We want that involvement, and there is a lot of education around patients and recovery and healing process for these kind of events. And when we really want to allow that time and to take those slow steps, and as Dr. Grove said, to really measure recovery in a thoughtful, caring, compassionate way.
Wonderful. Thank you both. So Cristobal, the next question is for you. Along the same lines, what would you say were the top 2 supports that were most important when you started your recovery plan?
I would say, let's see, when I started my recovery plan.
Yes. So what was most supportive? What was the best? What did someone do for you, or what did you receive that really helped in your recovery?
Yeah. I have 2 friends that are also mentors, and they're I don't know if I can name them. They probably wouldn't mind. They work for the county. It's Mert and Darren. Katie probably knows them. Yep. So Darren Belland and Mert Hirschberger, they're my friends and mentors, and they're a big support. So they've aided my recovery process. I've known Darren for the past 11 years, since I went to the Walk a Mile in My Shoes rally in 2010. And then Mert for the last few years. And, you know, so them and my parents, my wife and her family, my faith in God, all those things are supports that have aided in my recovery.
You've got a really good, strong support system, Cristobal. And it sounds like that's really good. Good for you. Thank you for sharing that.
Yeah, thank you.
Next question, and I'm not sure who to direct this one to you, but what are some effective ways that individuals can transition from an inpatient stay to a coordinated recovery plan without falling through the cracks? So either Katie or the Dr. Grove, either one of you.
Oh yeah, Katie, if you want to field this one, go for it. I guess I'm still
I was like, do you want to flip a coin? Yeah, I can start. So we are always available to assist with that transition. So Washtenaw County Community Mental Health, we have and Cristobal's part of this. We have a crisis cares team, which is available to anyone. So regardless of insurance, payer, no insurance, any of that. And the cares team, it can be very temporary. So it may be that hospital step down, see a psychiatrist, get a bridge to a different outpatient clinic, whatever the case may be. So I do want to say that. So we are available. We can get our access number in the chat. We can do all that. Thank you. All of that millage work. So this county passed, a mental health and safety millage, and that a portion of that funding went to that because that was an identified community need. So there is that. There are, of course, thank you, Maria. There is, of course, communities that don't have that kind of gap filler, because that was certainly something that our community was seeing. And that is a challenge. So I again, don't want to minimize that, what Dr. Grove said much more directly, and I appreciate that this is an ineffective system that has a lot of gaps in it. So we want to say in this county, we have that available, and it's not available in every system. So we would like to be that gap filler.
Great answer. And I want to add to that for those listening that as director for NAMI Washtenaw County, our three main areas are education, support, and advocacy. And so I cannot encourage enough participation in our no-cost programs for educating families on how all this works and what's not working, what works, and a community of folks that get it and understand what you're dealing with. And then we have the peer-to-peer programs for someone who is living with a mental health condition that can be with their peers. They're taught by peers, and they're only peers in that space. So they can be comfortable and be able to be open about what they're going through. I can't say enough about that in our support groups. That's how I got started with NAMI myself 12 years ago, when my loved one was going through a very difficult crisis that I didn't understand. And that family to family, just having that support right there, because we talk about supporting that person that has that illness, but the family is often left in the dark, not understanding what's going on or what to do. And sometimes we look at everything. We need to, we want everything for CMH to fix it all, or for Dr. Grove to fix it all. And really, it is a really community effort for all of us to do that. So please utilize those resources. So, all right, thank you. I'm gonna ask Cristobal a question going back to peer supports. Can you give us an idea, as you're a certified peer support specialist, what is it about your job that you really like? And what is a peer support? Well, first of all, what is a peer support specialist?
Sure. Well, let's see. So a peer support specialist, in my definition, would be someone who, I'm on the crisis team. There's different peer supports, but my role on the crisis team is to accompany the crisis service professionals, the CSPs, on the outreaches. And I'm there for support. Sometimes I will engage with the clients that we visit. I will share my lived experience with the mental illness. I do wellness calls. I perform wellness calls by phone. And I'll ask, basic questions, about their safety and their symptoms they're experiencing, do like a basic assessment. So, and I like doing all that. I like listening to my clients over the phone. I like interacting with them and typing out what they say on the computer. And I especially like the Spanish speaking clients, because I get to practice my Spanish speaking skills. So I can speak Spanish pretty well. And one of the ways I keep it up is by reading the Spanish Bible. And the Bible in the Spanish language.
That is terrific, Cristobal, because of course we want to make sure that we reach all communities as well. And that's very important that you are bilingual, and that's great. And that sounds like, I can't imagine I know what it would feel like for me to be understood if I'm dealing with a health condition or mental health condition, how to feel that sense of I'm not alone when I'm speaking to someone that truly may understand what I'm actually going through. So my hat's off to you and that work you do as a peer specialist. So we're wrapping up for tonight. I would like to ask Dr. Grove, if there are any last words that you would like to add? Maybe take a minute to two.
Yeah, what I saw in the Q&A, someone asking about the consequences of a serious mental illness and not really seeing recovery in that. And going back to what Katie said, yes, it's really difficult. And there are times when it feels like we're not making much progress at all. But I encourage everyone to stick with treatment. And if you've tried something before and it wasn't helpful, I talk about therapy in this way a lot, like try it again, and try it again and try it again. Because maybe it takes a few times to figure out, how is this going to work for me? So, and absolutely, I mean, we talk about psychosis recovery, serious mental illness recovery. There's an entire movement devoted to it. So it can happen. It takes a lot of work. It takes a lot of patience. So I'll go back to, we've got to stick with the process and keep going at it.
Wonderful. Thank you, Dr. Grove. 1 minute, Katie, final words.
Absolutely. I want to tie in what Dr. Grove said with what you said, Judy, earlier about reducing the stigma about this, having conversations about it, that we all here, everybody who showed up this evening, believe in the word recovery and that this is possible and that we're invested in the process. And if we can get our community invested in this process, that is really where we need to go. So to take it from an individual level to community level. So we have more prescribers, we have more supports, and there's more available to help all the individuals that we care about move along that recovery process.
Absolutely. Thank you. And Cristobal, any final words?
I would just say thank you for having me. It's been a pleasure, and it's a process. Recovery is a process.
Beautiful. Thank you. All right, we're going to wrap this series up right now. I want to thank our panelists again, and I want to thank everyone who participated in all three, and those that didn't get maybe to see the first two. We do have those would have been emailed out to you, and we will have copies for you and can send you those links. And what else do I want to say before we close out? If you have any questions that were not answered this evening, please email communications@namiwc.org, and we can hope to get those questions answered for you. So again, thank you everyone for participating tonight and showing up. We hope to do more of these because I think that they're invaluable. Share these with your friends and family. They can sit and watch this in the privacy of their own home, and continue to participate so we can fight the stigma that we need to on mental illness. Thank you, everyone, and have a wonderful night.